Dr. Omar Reda, thank you so much for joining us here on the Science of Psychotherapy podcast. Great to see you.
Thank you very much. It's such a pleasure and honor.
Oh, it's our honor, Omar, because we know what it's like to write a book. We've had the good fortune to have one of ours come out recently. But this particular book, The Wounded Healer, talking about the nature of psychotherapy and of therapists and of people, but their experience, their personal experience engaged. What led you to write the book, or what became the pathway that enabled it to come about?
Yeah, thank you. So I believe that most of us are wounded healers. So we have our own trauma stories. We have personal experiences, and I happened to, leave my home country as a refugee, and then when I came to the United States, it was after September 11. So went through some discrimination and hate and Islamophobia. And then my home country, Libya, went through a civil war in 2011. So I went and tried to help the children, try to work with people who were displaced, and then found myself at the border of Syria and Turkey, the border of Bangladesh and Burma, working with refugees. So I got engaged with this work and found out not only the clients that we serve have their own wounds and trauma stories, but also our families and ourselves, like wounded healers. So my focus this year has been on my colleagues, because many of them are leaving the field of medicine, and psychiatry, I believe, is the most beautiful field of medicine, by the way. And many of them, they leave because of compassion fatigue, vicarious trauma, and total burnout. Some of them are using substance so they can numb their moral distress and deal with their own PTSD, which I believe is a moral distress, not mental disorder. And then I started to write about the topic in the Psychiatric Times, and looks like I got the attention of Norton, which is a publishing company, who reached out to me and they asked if I can write the book.
Yeah, they reached out to you. That's marvelous. So your article, your essay, was obviously very impactful, but I think the subject matter is so impactful. I wrote some years ago, and I've been sort of pursuing the idea. I was asked to write an article about post-traumatic growth, which was very helpful for a lot of people. But I don't think they're disconnected. The nature of the fact of the traumatic difficulty, the traumatic stress, and this thing of growth, it's sort of a co-building experience. But you've done this, you've had this learning experience, not in although there's certainly a lot of traumas in the West, but you had it on the front lines in places where the battle was not mental, it was physical. So can you share with us some of the nature of that experience of both having trauma, having traumatic growth, and this complex interaction that happens with people?
Yeah, absolutely. I mean, I believe that, being on the front line doesn't necessarily only mean you're going to have physical wounds. Most of the struggle that we see in Libya right now, my home country, at least after the civil war, has been because of the invisible wounds, which is the psychosocial wounds. And this is the same thing that I see now in the aftermath of the pandemic. I think I predict we're going through a different kind of pandemic, which is a psychosocial crisis. Many people, because of the isolation and the human disconnection, are going through a difficult time. We have seen a sharp increase in the rates of depression and anger, substance use, and even suicide. That's why it's my mission to try to untangle all of this dysfunction, either on individual level or family level or community level.
Right. And there's a lot of these psychosocial wounds, as you say, like there's direct wounded and there's also vicarious wounds. And And so I'd love to hear more about your experience personally dealing with the vicarious trauma.
So there are many ways that I dealt with my own PTSD, and I'm very open about the fact that I actually had, encounters with the nightmares and flashbacks, and because I have seen firsthand the impact of how ugly human violence can be. I lost loved ones and was about to lose my whole family actually on March 19, 2011, when Mr. Gaddafi ordered the city of Benghazi to be completely wiped out. So my whole family and 750,000 people were about to die that day. And I was trying to get hold of my mom. And eventually, after many phone calls, I was able to. And she told me she was very proud of me that, I'm doing the right things by speaking up and taking care of the humanitarian needs of people. But then she said, son, I'm going to see you in heaven. And this is something that I never expected. I don't think any child should hear their mom, say that. And I'm glad that she survived that day, but I lost her in 2016. But still, I mean, listening to vicarious trauma means we are listening with compassion to the detailed pain of others. So we are bearing witness to traumatic stories of our clients, our community members, and in some cases, our loved ones. And that takes a very heavy toll on the soul. So I believe, PTSD of caregivers is actually something that affects our deep soul. And the more gentle you are, the more compassionate and empathetic, you pay the price of that in the form of compassion fatigue and vicarious trauma and even burnout if you don't find the balance through self-care.
Yes, I can't imagine that just in the audience listening now, that everybody hasn't had some degree of inward breath, as you just gave this very gentle overview of the difficulties and that struggle. I mean, I just found my head tilting to the side, like, oh my God. And so there's just a little taste. But one of the things that has been intriguing me lately is certainly this idea of being empathetic. So that sense where you actually have this co-experience of the difficulty and being attuned to somebody. So kind of knowing their experience, but not necessarily feeling it in the same sort of vicarious sort of way we do with empathy. And this, I think, what I feel as I read your book is that the stories are there to help us strengthen in some ways. What am I on some sort of track there, or and what was your feeling in sharing these stories in the book?
Yeah, I mean, absolutely right, Richard. I mean, so I believe that when we listen to trauma stories of others, we should not focus on the graphic and painful details that might give us despair and make us not believe in the beauty of humanity. I'm a big believer that humans are beautiful regardless of how we sometimes hate each other and damage and hurt each other. But I believe when you listen to someone, try to understand that they survived the worst of their trauma. So focus on their coping, on their resilience, and celebrate their culture. Try to be with them. That's what we do. We bear witness. We walk with our clients. We don't walk the walk for them. We don't disempower them. And, I don't walk into the room or a refugee camp or armed conflict zone as the, arrogant expert. I try to be humble and listen to the local context and try to learn from the culture or the religion how I can fill the gaps of whatever is missing. Because most people are trying their best given their circumstances. There are some resources and services already established. But whenever we go into a war zone or refugee camp, we try to connect with the local organizations first and learn what's missing. Most of the time, it's just training or education, supervision, consultation. And this is how I created my model, Untitled, And one part of Untangled is to take care of the caregiver. That's why the wounded healer.
Mm-hmm. So this aspect of focusing on strengths, on resilience, celebrating the positive things of the culture, these are protective measures for the caregiver.
Yeah, absolutely. Because like, we talk about post-traumatic growth, and I believe Dr. Gabor Mate also talks about post-traumatic wisdom. And I will never change my trauma story, despite how painful it is. I will not change a thing about it because it made me a better human. So this is what we get out of going through the fires of trauma. We learn how to grow. We learn things that make us more wise, but make things that make us more human.
Yes, yes.
And as a therapist, sorry, Matt, but just as a therapist, it's helping people reconnect with their growing mechanisms, their personal growing mechanisms. And I mean, we do a lot of, I have a lot of focus on the fact that every individual is a different system. So the thing is, there's a lack of consistency in your clients, yet we can have a consistency. Your Untangled approach is an approach that, to me, seems to feed into the fact that what you're untangling is a different story each time, is a different process. Is that also, though, a difficulty for a therapist to have to almost re-engage and reattune each time? It's easy to sort of just keep shoveling out the same stuff.
Well, I think we chose this field because we really care about others, and we most likely, when somebody leaves our office or the session, sometimes we reflect on what they got out of that session. And many times it's not really the medication that I prescribe or psychodynamic interpretation I make during the session. Most of the time it's the human connection, something more basic that they will come out of that session. So when I go to a refugee camp, it's not doing psychoanalysis or CBT necessarily. I don't expose people through exposure therapy or any kind of modality in the immediate aftermath. These are very important treatments
yes.
in the aftermath of trauma, but it's usually not in the immediate aftermath. So usually I just try to focus on psychological first aid, mental health first aid, their safety in the here and now. And Untangled, very briefly, is a model of 5 components. So when I go to an organization or a community or a country, the first thing is to tackle the stigma through education. Second thing is to raise capacity through training, usually training of trainers. So you leave a team behind that can continue this mission. The third one, which is very effective, is building safe spaces for the community. And I love doing play and art therapy with children during these safe spaces.
Yeah.
And the fourth one is building culturally sensitive resources like a hotline or crisis team. And very few people will need the fifth component, which is the actual therapy or medication management, the clinical services.
Yeah. It's very interesting that I did quite a lot of work in suicide, which was both, as you say, both fabulous and enriching, but also very difficult and testing. But those first 4, I recognize those very strongly. It's in the sense that very, very pragmatic, in the moment needs and enabling people to be able to function. It's a very functional sort of framework and sensitive to the individual as well. So it's really beautiful what you've done there.
And isn't it great that if you give people that have been through trauma these things, education, training, safe space, resources, like you said, most of the time they don't need the therapy, they don't need maybe the drug intervention, or that they have the capacity to I guess heal themselves in a way.
Yeah, I mean, Dr. Bruce Perry, in his recent book, What Happened to You, he actually said, most therapy happens outside the therapy room. So most healing happens outside our offices, It happens within our interpersonal space when I become a human, not necessarily have the power dynamic of being the therapist or the psychiatrist in the room. When I show my own compassion and humanity and vulnerability, many times I share my trauma story with people so they can understand that, you know, we can actually cope with trauma, learn from trauma, and become better people because of it.
Yes, and on this point of post-traumatic growth or wisdom, so you know, we're in the business because, you know, we have empathy and we care for people, but that also is like a risk factor for vicarious trauma. And yet when we go through it, it seems to increase our capacity for empathy. But then is there also a protective measure as well? So then it becomes less, our increased empathy becomes less of a risk factor?
Yeah, I mean, absolutely. We need to find a balance, I think, here, Matt. So many people, they engage and extremely engage on the expense of their own mental health. So if we practice self-care and we do it both in isolation, like doing solitary acts of taking care of our body, our mind, our heart, and our soul. And I'm a very big believer that we need to take care of our comprehensive well-being, because many of us, we go on breaks, but when we come from our vacation, we are as exhausted or more exhausted than when we left. And this is because we focus on the body. Very few of us, we engage in the wellness of our mind and our heart, and especially our soul. So this is one thing that's very important. The second thing, as you said, like the more gentle and compassionate you are, the more prone to compassion fatigue. So make sure that you have some gas left in your tank to give to your family, and especially don't give them the leftovers. Many times I say, you know, many of us in this field, we do this hard work on the expense of our loved ones. So we are chasing the quote unquote the American dream, and we lose the American dream chasing it. And we do this in every single country and every single culture. We try to take care of others, but most of the time, our loved ones get only the exhausted father who comes home and exhausted spouse, and then we have nothing left to take care of our own needs and nurse our own wounds. Some of us have very active wounds that are being reactivated every day, listening to traumatic stories of our clients.
Yeah, yeah. And now we've been talking about, especially in the world of psychotherapy, self-care for decades. And yet, in my experience of supervising psychotherapists, we still don't do that very well. What sort of tips, guidelines, methods do you have for self-care?
Yeah, I mean, there are many. One of them, as I said, if we are practicing self-care in isolation, I'm okay with that. But I believe most of healing of human suffering happens in a relational context. So it's important to also build community of care, you know, colleagues that care about us, neighbors, relatives, loved ones who will check on us and we check on them, and we become authentic and genuine and open about our own feelings. Because some people will say, I don't want to be a burden on my family. Believe it or not, your silence and your shutting down is more burdensome for them than you talking. And you will do anything for them. So now you are taking away their privilege to also be able to give. There is a book called the, Go Giver. And that book talks about how when we prevent people from giving, this is a kind of selfish, because we are trying to, reciprocate. I give to others, but also I receive from others. So there is nothing wrong about that. Some of us, we have our culture of if you practice self-care, that means you are selfish. And I think it's the most selfless thing to actually take care of yourself, because that means you will have enough to give to others. So if I have thousands of people who are relying on me and standing on my shoulder, the minute I fall, the whole system will crumble. So in order to protect them from falling and from losing me as a caregiver, I should take care of myself. So yes, there are tips to take care of the body. And we know that we practice that a lot, like maybe sleep hygiene and eating healthy and exercise and going on a walk, fresh air and breathing exercise and so on. But I also want to pay attention to the needs of our mind. So not engaging in self-loathing language, entertaining self-positive talk is very important. And taking care of our heart usually happens in a social context. So making sure we have enough healthy psychosocial support network, and also taking care of our deep soul. And you don't have to have a religion or a faith to do that, just to practice spirituality and look with the care and compassion to your very, very deep soul and listen to your inner voice.
And I'm just thinking there, which is something that is very important in the sharing, in the speaking of things, both because the other people can help you and the other family members and loved ones can engage, but also you can hear yourself, listen to yourself. And so you get that sort of objective, you get a sort of a subjective, objective view. But the value of sharing is that you can listen to yourself and see whether you're progressing and hear whether you're progressing or whether you're staying stuck. And I've noticed this with clients. If they come in and they talk about a problem and we do something, then the next time they come in, they talk about it, it's a little different and it's changed. I go, okay, we've got growth. But if they come back and keep talking about the problem and keep saying it and keep repeating it, then of course we've got some kind of negative feedback going. So by being able to say something, you're able to help yourself realize you're improving or not improving, but also it gives your loved ones an opportunity to say, hey, I think you're not improving. That's the 50th time you've told that same story the same way. These are the sorts of values of what, and do these sorts of stories, what are the stories that you have in your book that help us understand these sorts of aspects?
Yeah, I mean, I believe that the culture of therapy is so toxic that, we learn at very early stage in our career that we cannot talk about our feelings. It is shameful. I think sometimes I admire the courage of my patients who will open up about their feelings more than I do. So I don't practice what I preach. And this is very unfortunate. And I know there are real, concerns about losing your license and facing repercussions if you open up about especially your trauma or any mental health struggle. But, I shared many stories in the book about how to really be authentic. And I shared my own story going through many, many traumatic experiences, both inside and outside places of employment. And I thought my coworkers and people who read the book so far told me that gave them permission also to start to open up about their own stories. And they found out it's not as scary of a monster as they thought. And just spending a few minutes with someone through a community of care, you can change somebody's day and brighten it, or you can save somebody's life. So that's why I'm very passionate about this, because we lost enough of our colleagues and this has to stop.
Yeah, it was drummed into me, in my training, you don't share anything about yourself. It's not about you, it's all about the client. But I found, when I do share some of my own experiences, it creates such a good bond that the client sees me as a real feeling person that goes through stuff as well. And, obviously don't make it all about me, but it's so important to create that connection, I think.
Yeah, they told us self-disclosure is something you never do in therapy, or even outside therapy. The culture told us to do that. And, the Western culture will teach you that you are independent. You can do this on your own. You don't need anybody. Showing any vulnerability is a sign of weakness. So you learn to suffer in silence. At the same time, the Eastern culture, especially where I come from, the Arabic culture, they teach us that if I talk about my feelings, I'm going to burden my family and my community.
Yeah.
So I keep the secret because it is a burden on others.
Yeah, I see some of this coming out of sort of a corporate coaching culture where, you know, we learn to leave it at the office, you know, to deal with it there, don't bring anything home. And then there's sort of this stigma that if you do bring anything home, if you do talk about, I don't know, a difficult day at the office or a difficult day of counseling, then you know, you're not performing your role. You should have left it all there at the office.
But also that other corporate coaching type of thing where everything's fantastic, everything's always wonderful. I mean, you get that dishonest, as you say, inauthentic sort of thing. So what sort of, in finding the authenticity, it's difficult. See, I find it very difficult because my training for being a psychotherapist, for what I call the sensitivity, was I was an actor for 25 years, but I sort of had that career first. And so that's all we did. It was all we did was talk about our vulnerabilities, and, you know, and shared our stuff. I've had to tone it down, pull it back. But I think what Aronson and Steele really captured it when they talked about the stereotype threat, just this background idea of what you're supposed to do that then becomes automatic thinking. So we're not just withholding ourselves by cognitively restraining ourselves. We actually restrain ourselves as a implicit behavior. And this is. Is this, what sort of experiences have you had with therapists and with other people? Do you talk about this sort of aspect in the book?
Yeah, I mean, I believe many of us, we practice what we call superficial kindness. And I love the book Deep Kindness by Houston Kraft. He mentioned that, one day he was in the airport and he noticed that, somebody was sitting next to him and was curious about his book. And she said, what are you writing about? And he got a little annoyed because he wanted to sleep and was very tired. But he said, I'm talking about deep kindness. And when he explained the topic, the lady started to cry. And he said, what's going on? She told him, before boarding the plane, the doctor told her, your father is going to pass away. You have to come immediately. And unfortunately, while waiting for the plane, her father died before she could see him. And she said that she spent a couple of hours in the airport crying at the corner of the airport. And about 3,000 people came by, passed by her, and not a single one said, hey, are you okay? Can I give you a tissue? Is your day okay? What can I do for you? And he said, this is what we do also in our places of employment. I will say, hey, Richard, hey, Matt, how's your day going? And I don't even wait for the answer.
I'm fine. Yeah.
And even because I'm used to you not listening to my answer, I would tell you I am fine when I'm really not fine. When I say, how are you today? I should sit down for a few minutes and really listen to you and understand how's your day going. So, I came across a story recently about somebody who went to the Golden Gate Bridge in San Francisco, which is in California. And he went because that bridge is very famous for suicide. So he said that morning, I wanted to give humanity one more time. I will give them one more chance to prove that humans care about one another. So if one person told me, good morning, or how's your day going, or why are you on the top of the bridge? If even somebody kept an eye contact or smiled at me, I'm not going to jump. And he said for about 15 to 20 minutes, hundreds of people passed, but not a single human made a human connection. And he decided to jump, and he survived. And, right now, he's going to high schools, talking to, our children, how important it is to spend a few minutes of deep kindness with someone, because you are not going to only change their day, you might actually save their lives.
Yes, it's in the research I was doing, the Golden Gate Bridge was an extraordinary. There was a lot of studies done there, lots of interviews with people who had survived, but I did find an extraordinary bit of film, and I'll just share that because it's in the story that you're saying. And this chap, he went there. He went there looking left and right as he stood. Nobody paid him any attention. He sat up on the rail facing inwards, Nobody paid him attention. And there were people just 10 or 12 feet away, maybe 15 feet, a little way. He then stood up on the rail, and still nobody said anything. The only thing that did happen, but he obviously didn't hear, someone did toot their horn, and then he let himself go. And it was just that that idea of when being connected, finding a nature of connecting, of being meaningful. But your story and my viewing of this video, they weren't asking for much. They're not asking for us to open up, and it's just to smile, just to engage, and this simplicity has been lost to some degree. I wonder, it worries me a little. Does it worry you at all, Omar, in your views of these different nationalities, different places, different cultures?
Yeah, I mean, we have, I think, existential crisis of not caring about one another. Yet, I think humans continue to show beauty. I want to share one story because in March of 2019, if you remember, somebody in New Zealand walked into a mosque and he opened fire, killing 51 people during their Friday prayer. So that day, one of my colleagues, who happened to be a Jewish neurologist, he survived, basically his family survived the Holocaust, and he had his own trauma story, but I never met him before. He called me that morning and he said, Omar, can we meet a cup of coffee in the cafeteria? And we sat down, and he just told me that morning he wanted to have a safe space for me. He wanted to just be there for me and bear witness. And then he said, Omar, can I do anything for you? What do you need today? And I said, you already did it. So it didn't take much, just a tender moment of kindness, and just a random act of kindness towards a total stranger is all I needed that day to feel safe and to feel connected. So I absolutely agree with you. Most of our healing happens in these tender moments.
Yeah. And like you say, it does seem like, especially, well, the Western culture that I know, we are in an existential crisis. Like Richard, I've seen fair share of video reports of people ignoring people who are obviously in need of help. And therapists, psychiatrists, we're on the front line of turning the tide, I would say. So
yes, I mean, it is interesting, this word beauty that has come up so often. I know my mentor Ernest Rossi wrote in 1990. It was art, truth, and beauty as a way of guiding. And I was fascinated listening to a TED talk by Murray Gell-Mann, the astrophysicist, and he was saying, we know that a mathematical equation is correct when it is beautiful. And he actually said, I did this beautiful equation, and everybody tried to say it was wrong, but no, it was more beautiful. But that beauty we have a sense of it, and it's a natural indicator of things being well. Now we then try and institutionalize, and we do all kinds of things to ruin it by saying you're beautiful if you are so high or so tall, or wear certain makeup, or wear the right clothes. But it's almost like all these fashionable things are trying to make up for the difficulty of us recognizing beauty naturally just through kindness. And that's a beautiful story that you had of your restaurant, that the beauty was expressed simply through kindness.
Yeah, I mean, my mentor in the Harvard program, Refugee Trauma, Dr. Richard Molika, he wrote a very beautiful, manifesto. He called it Healing a Violent World. And he actually told me, Omar, if you don't practice beauty, that means you are not practicing medicine. You have to look for beauty in every single interpersonal encounter with your clients. And I have been doing that and have been very pleasantly surprised. I find beauty in the most unlikely of places.
Yeah, that's wonderful.
So my principal work is in curiosity. And if you're curious about finding beauty, then the very beginning of your day is a wonderful place. I couldn't you couldn't have expressed my own thoughts any more wonderfully.
I'm also reminded of this challenge, that often pops up, and that's if we could just do one act of kindness, each day, that it would have a dramatic impact on the planet. And I think that's always a good challenge for all of us. We can all do one small act of kindness, right?
Absolutely, and it doesn't have to cost any money. Actually, most of these acts of kindness come for free. And I'm a big fan of the work of Rumi, who writes very elegantly about the beauty of the human spirit. But one thing that he said, you can find beauty in the most ugly of places. He said, actually, there are beautiful things you can only see in the dark. So in the dark, when it's dark outside, we can see the full moon and shining stars and butterflies and fireworks. And, you can also see the beauty of the human spirit when it's tested with adversity.
Yes. Yeah. So if I can share some of the words from your own book, you're talking about a journey of the heart, and Smink, you reference him. Is it caregivers are hosts? They treat their guests with hospitality, sharing the best of what they have. Hospitality entertains curiosity about the guest's story without neglecting that of the host. Welcome the interior movements of your soul. At the heart of compassion is hospitality. As you welcome the stranger, your own humanity and dignity get restored. To care for a guest is to welcome the divine. Wow.
Yep. So that's so poetic.
Yeah, I mean, Dr. Edward Smink, he wrote a very beautiful book, The Soul of Caregiving, and he has been an excellent mentor for me. And really, this work is a work of the soul. We cannot do it just with our body or our tongues. And I know, unfortunately, the practice of medicine is moving away from that. The field is more focused on electronic medical records, and you spend more time with the chart more than with the client. But I think we can do better, and we should do better. We cannot afford the status quo.
Yes, we need to know right, but we also need to feel right. This is a testing task, and it's one thing that to some extent in our new book we're trying to express is the knowledge is valuable, but the knowledge is valuable only to make us more capable of recognizing the other person. As you conduct your practice now, do you attract, or do you find there's a certain type of client coming? Do you have a wide spectrum, or do you find that what do you find in your own practice and how you present this material?
Yeah, I mean, being curious is very, very important, and being authentic is very important. And sometimes yes, I see clients from all kinds of, quote unquote diagnoses, but, even those who are hostile, most of them, they hurt you because they are hurt. That many people, they quote unquote act out symptom that they cannot tell with their own words. It's very difficult for them to put their experience into words, so they act that through a behavior. And we see that very commonly with the children. So I just try to, lean in rather than time out and putting people in seclusion and restraint. Let us bring them into time in, sit down with them and try to bear witness as safely as we can. Of course, we don't jeopardize our safety. But I have been extremely surprised and pleased with this approach. I think we can do wonderful things if we just listen to one another. I mean, imagine the words of Dr. Smink when treating a refugee or asylum seeker, somebody who doesn't speak the language or a total stranger. Just treat them as non-strangers, because Dr. Valerie Kaur, in her book, See No Stranger, she did an amazing job how to she saw people who walked into her temple. She was a Sikh. Somebody walked into their temple and opened fire, exactly like what they did in New Zealand. And she said there must be a trauma story behind why they hate us. Why somebody hate me even though they never met me before. Why somebody call me names because of the way I decide to practice my religion, or the way my wife is dressed, just I try to find compassion even for people who hate my guts.
Yes, yeah. And it is that, and I think one of the things that I'm finding annoying, a bit upsetting, is that when you express something like that, saying, there's someone doing something terrible to me, what is their trauma? That there's this rising of saying, oh, you're forgiving them, or you're accepting their bad behavior, and this is just missing the point that understanding, and certainly that particular event, I would think that yes, that person, that's it, they've done that terrible act, and so it has to go through a process. But who else is out there? That what is this trauma? This capacity for us to take a negative event and use that to creatively alter the conditions of the environment for those people who may be heading in that pathway. I mean, your book is going to, just by its presence and being read, and people just listening to that simple paragraph from Professor Spink, that just might shift a direction.
Yeah.
Is that, what was really when you do these stories, do you do other public speaking where you're able to share these experiences?
Yeah, I mean, I love public speaking, and if you know me before the war in Libya, I was the most introvert. I cannot do any public speaking. I was very, very anxious in front of crowd. But then there are like 5 million Libyans who are voiceless, and I have the privilege of telling their stories. And then when I went to Syria and Burma, working with the refugees from different backgrounds, I can become their voice. So it's an honor and privilege, and that's why I take any opportunity to share my story, because it's not only cathartic for me, it's hopefully healing for others.
Fantastic. Well, we really appreciate you being and for Norton contacting you and being able to do this project and put some of these things down in The Wounded Healer. And we'll point everybody to that resource in the show notes. Is there anywhere else people can connect with you? A website?
Yeah, I mean, my website is dromarreda.com, and also I have projectuntangle.org.
Fantastic.
We'll put in our magazine, which comes out every month. So that also will give people to spend some time with the words, and then hopefully be inspired to go out and get the whole book. That's our goal, for people to engage in the knowing about. It's certainly, we're not encouraging people to race off to war zones so that they can get what it's like. They can just read your book, and they can get a great deal of insight. And this is the beauty of your message. It's a safe way of learning about difficulty.
Yeah, fantastic.
Thank you very much.
Dr. Omar Reda, thank you so much for being with us here on the Science of Psychotherapy podcast. It's just been so great talking.
Yeah, thank you very much. It has been really a privilege.
Beautiful. Thank you so much.